If you think you can travel outside Canada to get your COVID vaccine and then skip the mandatory quarantine on your way back in, think again. The Public Health Agency of Canada is making it clear there will be no exemptions for anyone leaving the country just to get a jab. Janice McGregor is on this story for us, joining me live from Ottawa. Good morning, Janice. So let's talk more about this clarification about quarantine exemptions for travellers and why this needed to be clarified. What is Ottawa saying?
Good morning, Jennifer. You're right. So this is a new email from a spokesperson for Health Canada and the Public Health Agency received last evening. And in it says that this exemption from quarantine that's currently available for those travelers who have received life-saving medical treatments from a foreign practitioner, it was not intended for those who were traveling, for example, just to the U.S. to receive a COVID-19 vaccine. The provision was only put in place for life-saving essential medical treatment. And the Public Health Agency now says it's going to be taking steps to make sure that this clarification is made evident for anyone who is thinking that those kind of more casual trips would be possible. It was never easy to be exempted from the 14-day quarantine period. Even if you were going for essential health services, you needed paperwork from your Canadian healthcare practitioner attesting to the fact that this was urgent and life-saving. You also needed paperwork from the foreign medical services provider as to exactly what procedure you received and the absolute necessity of that. So if you did not have that paperwork when you returned, you would be treated like any other traveler, shown your way into that 2-week isolation and testing process that any other Canadian resident or citizen returning to this country has to go through when they return from abroad. Now, as far as the U.S. specifically is concerned, I think the other thing important to point out is, of course, our land border remains closed to non-essential travel at least until June 21st. U.S. border officers are supposed to be stopping anyone who isn't going over for an emergency or an essential work purposes. This was never intended to allow, say, a carload of people who just wanted to make a day trip to Walmart to get their needles.
Well, and so that was my next question is, who is this speaking to? Because clearly Ottawa felt they needed to say, hey, wait a minute, guys, because they were seeing evidence of this kind of COVID vaccine tourism, I guess, bubbling up.
Well, maybe wanting to stop it before it started. There have been programs, for example, for essential workers. We saw the prairie provinces enter into agreements with states like North Dakota, Montana, for example, a few thousand. Truck drivers are getting single-dose shots down there to kind of ease their work and make it more safe. But there was confusion that arose specifically in Windsor when the CEO of the regional hospital said that he was aware of a U.S. medical institution that was willing to provide shots for Canadians. And he'd entered into some correspondence with the Public Health Agency about whether this quarantine would apply if people started going over to receive that treatment. And he said officials had suggested that, yes, it could apply. But with this clarification, this communication now, it is evident that no, if you're only going over for a vaccination, not another kind of treatment, it in fact would not be an applicable life-saving kind of essential reason. I'll just add quickly, Jennifer, I know people remain anxious about getting, if not their first shot, then definitely their second and having this all done with. But as the weeks pass, Canada is catching up to the US. I found it interesting. In researching this, I noted earlier this month, actually, the number of people who had received at least one shot actually is higher now in Windsor than it is in Detroit.
There you go. Important information. Janice, thank you. Janice McGregor in Ottawa.